What's going on, everyone? Happy Monday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far. I hope you had a great weekend, but I hope you had to hopefully test negative for the viruses if you had to take a test for any of them over the weekend. It is time now for the Monday edition of the Virus Update for Monday, August 25th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed of what's going on with these viruses. That's what I do here on my channel each and every day. Want to stay informed? Just subscribe to my channel down below. Give this video a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Alrighty, going to be a rather easy news day. We're going to do some of the weekly things that we do here in news and a few other things. And then we're going to take a look at some daily data. New York State, hopefully, been refreshing. Haven't seen anything. And we are also going to take a look at Walgreens and Wastewater SCAN. There are some things that I have written down here that we need to look at on Wastewater SCAN. Starting off with this, the BNO News Weekly COVID Update. New COVID cases reported this week. It's gone up. It's continuing to go up. 115,671 estimated. Admissions, 8,097. That is up by 18%. Yeah, hospital admissions. In case you're tuning in here, you're like, oh, what? A video about viruses? I thought COVID was over. No, COVID's not over. And as you can see here, this is in the United States. In the hospital, 5,623. That is up by 18%. In the ICU, 639, that's up by 10%. New deaths, 250. The average is 225. That is up by 10%. Some of these numbers here may differ from the numbers that you see from CJS. BNO likely compiles their numbers may be different than CJS would when we take a look at his data, usually in the middle of the week and then again over the weekend. All right, taking a look at the next tweet that they made. COVID cases continue to rise across the U.S., reaching the highest level since March. Emergency department visits are up among all age groups and highest in young children, according to the CDC. So far this year, more than 3.7 million COVID cases have been reported in the United States, causing 261,049 hospitalizations and 17,289 deaths. And when we say 3.7 million, we're not including the at-home test. We're not including the people that do not bother to test. Yeah, there's all of that too. So there have probably been way more COVID cases in the United States than we know about this year. I know a lot of people now are starting to run out of fingers on one hand of how many times they've had COVID. I'm hearing people have it 3, 4, 5 times now, and yes, some people may need 2 hands to show the number of fingers for how many cases of COVID they have had up to this point. It's a sad state of reality, and here we are. It's 2025. COVID started in 2020. Some people are getting it every year. Yeah, not a good thing. Not a good thing. The more times you get it, the higher your risk is of long COVID and a whole bunch of other things. All right, this is from Sarah Ann Willett. She posted this the other day, and it is in relation to the viral activity levels in the United States. She puts, the CDC knows that SARS-2 is rising, but barely added data to their wastewater concentration and metric data sheets. Yeah, they didn't. That wastewater page did not update this week. And there's data sheets that a lot of people access. I don't look at them. That goes over my head. I'm being very honest. I'm not good with that stuff. But I do show you the pages here on the channel, and that's one of them that have not updated this week. Updating her wastewater viz this week only included data from Wastewater SCAN and state reporting. Take a look at this when it comes to viral activity levels. The Southeast is pretty much still continuing to grow at this time. The Northeast is, you can see here, well, likely growing at this time. And there's just a few states that are not changing, but we can see this red and orange Northeast, and take a look at the West Coast. The West Coast has red and orange as well. Some of the plains has some red. Texas is still doing really bad. In the Southeast, Florida is still really bad. And we see that orange is even in Alaska at this time. So things are still likely growing there as well. All right, let's go international for a second. Let's go over to Australia, shall we? Queensland weekly respiratory surveillance reports. for August 19th to the 25th of 2025. Reported cases, COVID 988, that's up by 2.8%. Influenza, 4,260 cases, up by 0.7%. RSV, 849, or down by 6.9%. Hospitalizations, COVID, 89, down by 1.1%. Influenza, 269, up by 2.6%. RSV, 64 cases, up by 10.3% at this time. NP.1.8.1, that's NB, not NP. NB.1.8.1 is the dominant lineage at 58%. KP.3.1.1 is at 28%. XFG is at 10% at this time. Alrighty, moving on now to this, also from Dennis the COVID Info Guy. Just going to read this little bit here. Long COVID is more than fatigue. Our new study suggests its impact is similar to stroke or Parkinson's. Evidence shows long COVID is quite serious. It can lower quality of life to levels of chronic fatigue syndrome, stroke, arthritis, and Parkinson's. Yikes, that sounds really bad. And, well, we've known about this. It's not good whatsoever what COVID can do to a person. All right, moving on now to this. In Ohio, yes, whooping cough is a problem in Ohio. Lorain County is reporting that they are currently dealing with a whooping cough outbreak, and they are monitoring and addressing the outbreak after positive pertussis cases were reported. And yes, this does not sound good. As we know, schools are opening up all around the United States. I'm sure schools are opening, or probably are opening this week in that particular area. So, yes, not good to see a whooping cough outbreak now starting there in Ohio. All right, take a look at the website now. It looks like we might have something with Legionnaires disease. This was just posted. Let's see here. Yes, that New York City outbreak is now at 6 deaths, 112 cases, and 7 people are currently in the hospital. Cooling towers were ruled as the cause of the outbreak, and these have since been cleaned and treated. Hopefully, we will not see any more cases from this outbreak. All right, taking a look at the viral activity levels for Canada, and we do see COVID-19. Look at that. I just refreshed it. It has gone back up to moderate once again. Flu A is low, Flu B is low, RSV is low. For my Canadian followers or subscribers, if any of you happen to watch today's video, could you let me know in the comments down below? When do you go back to school in Canada? Did it start yet? Is it about to start? What's the deal with that? When does school start in Canada? I would like to know. And if anyone else knows, hey, feel free to let me know down below. I want to know when you go back because, hey, moderate levels now and, school, poor timing for that to happen. All right, let's take a look at what's going on with air qualities. You're going to see they're not bad in the east. The east is not the problem anymore. The west coast, fires. Yeah, look at this. And I read an article earlier that there is some evacuations potentially starting up in some place, I believe in California, but take a look north of there. Problems as well. So things are really heating up when it comes to bad air quality and wildfire smoke in California, Colorado, Wyoming, Montana, Idaho, Oregon, Washington. Really bad. If you have to go outside, yeah, I hate to say it. People hate it when I talk about this. Might be time to wear a respirator or some sort of a mask. It's time because, that bad air quality is not doing you any favors. It's not good for your lungs. Alrighty, let's take a look at EMS calls. We didn't do this yesterday. We just saw Philadelphia. That was it. And unfortunately, Pinellas County, Florida is reporting a high number of calls today. Sick person, I see it. 1, 2, 3, 4, 5. Yeah, I've been monitoring this. They've been dealing with a lot of sick person calls. Philadelphia yesterday had 751 EMS incidents. A note about my area in just a moment. I got to show you this. Montgomery County, you see 2 respiratory emergency calls right now. But let's see. Maybe things have changed. But I saw a lot of sick person calls earlier in Chester County, Pennsylvania. There were like 5 or 6 of them. Okay, there's 1, 2, 3, 4 of them, and 2 respiratory emergency calls. Yeah, I got to bring out something that I usually do during the Out in the Wild updates, and that is the coffee meter. I got to tell you something. If I was doing the coffee meter right now, it would be up. I would say on a scale of 1 to 10, we'll say a 5.8, maybe a 6. I'm hearing a lot of people coughing right now, and it's August. This time of year in August, I shouldn't hear that. Someone's probably about to say, "Oh, it is about time for ragweed," or something like that. Yeah, even then so. A little bit more coughing than we should be hearing for this time of year. Hopefully tomorrow we will get Pennsylvania's wastewater update from our wastewater dashboard and maybe get some clarification. Until then, we can look at Wastewater SCAN. We will look at Wastewater SCAN in just a few moments because there's several things I want to look at there around the United States. Taking a look at what is going on in Bucks County, Pennsylvania, if this ever decides to refresh. And while we're waiting for that, oh my, before we do the hydration break, wow, 15 EMS calls there right now. Let's see what's some of this. This may be the most I've ever seen for Bucks County. Mind you, this is a new dashboard. I don't know how potentially high Bucks County can get. We see some of the other counties go over 20 sometime, and this is a populated county. I'm seeing respiratory distress. I'm seeing several different things showing up there. Let's take a look at the hospital situation in Pennsylvania. And you know what? Some good news here. You are seeing some hospitals that are yellow that are busy, but we are seeing ones for behavioral health diversion. We also see overcrowding. Okay, it's not as busy as it was last Monday. Last Monday was pretty bad here in Pennsylvania. Yes, there are some hospitals not as bad as last Monday, which there were a ton of hospitals listed in yellow last Monday. Probably the most I've seen this summer. New Jersey, okay, right off the bat, we're seeing some problems. Inspira Medical Center Mannington has a specialty issue. Also, Inspira Center Mullica Hill, psychiatric issue. Looks like that's a volume and capacity issue. And that's it. Just two problems in New Jersey today with the hospitals. Taking a look at New York State. We need to refresh this. While this is refreshing, let's pause and take that hydration break, shall we? Alrighty, most recent update here. It says 523 new cases. Let's see if the hospitalizations updated at all today. And it looks like no, this is the same number. So these are the same numbers from last Friday. Currently hospitalized, 381. Patients in the ICU at this time, 51. All right, moving on now to the weekly Walgreens update. Good news, bad news, and bad news could be a little good news. It'll make sense to you in a second. Here's the good news. Positivity rate, 32.3%. That's down from 0.6% from 32.8% last week. And down is a good thing. Here's where it gets bad. More interest in testing. It's good that more people are testing. It's bad that the interest is going up because, well, maybe cases is going up. 4,087 people got tested versus 3,597. But there's a little bit more good with that. The fact that the testing went up and it brought the positivity rate down, that means maybe there's a little bit of light at the end of the tunnel. Because if the number of tests went up, we've seen this many times before, where the number of tests goes up and it doesn't outdo the positivity rate increase, yeah, that's bad. But hey, testing went up, positivity rate went down and not up, so that's a good thing. But you still see some red here. Let's take a look at some of these red states. And red meaning increasing COVID levels, green meaning dropping positivity levels. I shouldn't say COVID levels, because what COVID's doing and what Walgreens is showing sometimes could be different because Walgreens is a really small sample size. Example, New Mexico, only 24 tests. But take a look at this. 41.7% positivity rate. That's pretty bad. You need more people testing there. The prior week was 30.8%. That's up by 10.9%. Let's go directly north of you. Colorado's pretty bad too. 31.8%. That's up by 6.8%. Total tests, 44 versus 48. Again, these are just people who show up to get tested at Walgreens. Illinois does a bit more testing at Walgreens. More people have showed up for a test there. 202 people got tested. However, your positivity rate still went up. 30.2% versus 23.4%. Difference of up 6.8%. Louisiana, can we get some good news there? No. 30.4% positivity rate. That's up by 7.1%. The prior week was 23.2%. Total testing was the same. So, yeah, you likely may still be going up. Louisiana's been hit oh so hard this year and so many times this year. Mississippi, this is not good at all. 35% positivity rate. Last week was 13.9%. Well, that works out to a 21.1% increase. Total test, 40 versus 36. Let's go to Ohio. 28.3%. The prior week was 20.5%. Difference of up 7.7%. Total test, 46 versus 39. Virginia, 33% positivity rate. That's up by 12.4%. Your testing did drop, 97 versus 131. And we see North Carolina, yikes, 36% positivity rate, up by 11.1%. Big testing increase to 239 versus 161. Yikes, so North Carolina is still doing bad. I'm seeing bad news in Washington. What's going on there? The positivity rate in Washington is 37.5%. Prior week is 36.1%. That's up by 1.4%. And your testing went up, 48 versus 36. Tennessee, 26.7% positivity rate, up by 4.1%. 146 total tests versus 128. Hey, New York's in the green this week. 25% positivity rate. That's down by 9.8%. Also seeing green in New Jersey. 20.7% positivity rate. Hey, that's down by 11.5%. And let's end Walgreens at Florida, where the positivity rate is 32.8%. That's down by 4.5%. Alrighty, let's make our way over to Wastewater SCAN, shall we? And we'll start off with what I have written down here at the end of my little list. And you know what? We actually do need to refresh this. Let's take a look here at Mount Pleasant, Michigan? Yes. Now, why are we looking at Mount Pleasant, Michigan? I'll show you why. First off, COVID at this time. It was going up, and then it dropped ever so slightly. Draw your attention to this. Norovirus. And over multiple updates. Yeah, rapid rise for norovirus at this wastewater site. Also, recent detection of hepatitis A. That's not good, but yeah, we're watching this little norovirus issue starting to appear here and there in more wastewater sites. So that's something that is not good to see whatsoever. And take a look at this. This is also not good. All the wastewater regions, the West Coast, the Midwest, the Northeast, the South, all are listed high at this time on Wastewater SCAN. Now, there's something else we need to take a look at. And I believe it is for, let's see, is it for measles or is it for Mpox? No, it's for measles. Here it is. I got it written down. Big Creek, Roswell, Georgia. Yeah, unfortunately, there is a measles detection at this wastewater site. And you can see at this site, medium levels for COVID at this time. They've dropped ever so slightly. But then we come down here. There you go. Recent detection of measles on August 18th. So we'll be watching for a news story out of Atlanta or northern portions of Roswell, is a suburb of Atlanta. So we'll be watching to see if anything pops up. All right, let's take a look at COVID now in Tennessee. We do see Chattanooga, Tennessee. I promised yesterday I would do this. Chattanooga, Tennessee, 400,000 population, and is rising at this time. Also some hepatitis detections. Also rising for norovirus at this time. So again, another wastewater site with a norovirus detection. Do we have anywhere else in Tennessee? Yes. We can go to Memphis, Tennessee. What is going on here? COVID is rising, and how's norovirus doing there? It was rising, but now it's starting to drop off a little bit. Several detections of hepatitis A at that wastewater site. All right, the other day, someone asked me about strep throat in Indiana, said there's a lot of it going on. I did some searching, did not see any news stories there, but let's take a look at one wastewater site there. Carmel, Indiana. Take a look at this. And it's going up pretty good. And yet again, another norovirus detection. I'm concerned. There's a lot of wastewater sites starting to show up with norovirus issues. Let's end today out on the West Coast, and we'll go to like east of LA. Let's go to Riverside, California. Oh my. Wow, look at this. 250,000 population. And take a look at what is going on with the COVID in wastewater. It is rapidly going up. So we can safely say today, although it's not safe in these areas, we do have some new hotspots that have popped up. Maybe that'll be what I title today. More new COVID hotspots have appeared. I don't know. Let's look somewhere else in California. Let's look at Sacramento. Sacramento has had its share of issues this summer. COVID there is still going up. And we can see at this time, hepatitis A detection. Measles detections were back in June. Not seeing any more. Glad to see that has since slowed down. I'm looking, are there any Mpox detections? No, none there. Alrighty, folks, that does it for the Monday edition of the Virus Update. Again, I apologize if we don't get to certain states. It's because some states just do not have any data with that CDC map being on. That really hurt us. CDC used to have a map with wastewater sites in just about every state, including Wyoming and Montana, and their page is not even updated now. As you can see here, there's nothing for Montana, nothing for Wyoming. The Dakotas, I don't think I can do anything. What's this here? Yeah, Yankton, South Dakota. I can look at that, and that's about it. You see, that went up ever so slightly for COVID. Yet again, another norovirus issue. Yeah, I'm concerned about that. Alrighty, folks, if you enjoyed today's update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. Of course, hit that notification bell. Ways to support the channel, such as Patreon, becoming a member of the channel, or whatever, are listed down below. I will see everyone again tomorrow. I don't know if it's going to be a data-filled at-home update or a data-filled or some sort of an out-in-the-wild update. That is a possibility tomorrow. Until I see everyone again tomorrow, stay safe, have a fantastic Monday evening, and thank you for watching. See you again next time.